Okay. Hey guys, we were going live with Dr. Max Gulhane, but we had a bit of a scheduling issue, so we're just going to do a bit of a Q&A regarding some of the questions that lots of people have been sending me regarding your mouth, your dental health, your dietary intakes. We had a really exciting conference 2 weeks ago called Pioneering Prevention, where we had a lot of specialists talking about how we're bringing forward, the discussion of the changing recommendations of nutritional intake and how we can really use this to affect our health in life. So love for you guys to jump on. Oh, someone's saying hello from Texas. So tell us where you're joining in, and if you'd like to send a few questions through, we can answer them live. So we've had a lot of questions about kids' teeth, and okay, so here's a really good question on an eat sleep device for sleep apnea, and this is a really important one because it's something that I'm seeing in patients so often now that and even I'm seeing so many males and females in their 30s with sleep apnea, and this is a really important one. That sleep apnea is not an easy condition to kind of reverse once you have it, because it's a long-term breathing and brain stem issue that affects your both your sleep but also to the oxygenation of your blood. And there is a progressive problem that reduces the quality of your sleep, and that is very difficult to reverse. And so what's really important is to capture the earlier signs of sleep apnea, because sleep apnea can be picked up often earlier and often in childhood, where breathing issues, what we often see is that the breathing issues are there to begin with, and then what happens is that the warning signs of the breathing problems are not addressed, and then it becomes sleep apnea later in life. And so snoring and pausing in sleep can be quite silent in children, but then in adults it becomes very important. It becomes often destructive to our health. And what I see in the clinic is that males won't notice. They're told by their partner that they're snoring, and they're sent to the clinic to have an assessment for sleep apnea. We can actually do a 3D scan on their airways and check exactly where the airway is blocking, and you can see it orally as well. You can see if the tongue is falling back into the throat. There's actually 3 areas the airway can block, and that's so in the back of the nose, so you'll get that nasal snoring, even through the nostrils as well if there's a closed nostril or enlarged turbinates. But then you can get the back of the oropharyngeal area, which is behind the throat, which is more like throat snoring, but that's when the tongue is falling back into the throat as well. So we often get these kind of presentations, but then the question is, how can we fix it? And so conventionally, what happens is that you can have a CPAP machine prescribed. If you've had a polysomnograph, you go to a sleep specialist, you get a CPAP machine, which is literally life support, while you sleep. So it's a breathing machine while you sleep. And then what this does is that it puts you on the machine for life. The compliance with these machines, between 40 to 60%. A lot of people do find it very difficult to sleep properly with it. Some people have a good result out of that. And then what happens is that, so the other way that we can support this is that if there's a long-term problem, sometimes an orthopedic splint that supports the dental jaw that stops it from closing and stops the tongue from collapsing into the mouth. Oh, we've just had a question to do with teeth grinding with kids, and I'll cover this after because this is relevant to this whole conversation. But the other option for an adult with sleep apnea is an orthopedic splint that holds the jaw forward. And this is sometimes good for people that present with teeth grinding in in adulthood alongside snoring, or they've been tested for sleep apnea, and they have been uh, diagnosed positive for obstructive sleep apnea, but they can't tolerate a CPAP machine. But then what a splint kind of helps us do is give them maybe a pathway off not having to sleep with a breathing machine. So there's those two pathways, and then there's a more functional approach that involves a little bit more of an analysis of the jaw. So looking at the upper and lower jaw, and can we widen the jaw? Because you can do that in adults. You can widen the jaw, and if the volume of the upper airway is the problem, then that can be an issue with with resistance through the airway causing snoring. So there can be expansion strategies for an adult. Now it's long and difficult. Some are more rapid and surgical, but the more the slower versions are long and difficult. But then, so what happens is that we can do expansion therapy. The other avenue is myofunctional therapy for the tongue, and that's strengthening the tongue to seal to the roof of the mouth. And what this does is it helps to tone the back of the throat, the oropharyngeal area, and it helps these muscles to become more taut, and you're teaching your tongue to seal to the roof of the mouth. And I'll speak after why this is, how this connects to teeth grinding as well, because teeth grinding is very much connected to the problem of sleep apnea and the obstruction of the airway. So there's three solutions there for people with sleep apnea, but what I really encourage is to get yourself assessed early so that you're not trying to reverse a long-term problem, because it becomes an issue with the brain, it becomes an issue with the cardiovascular disease, and it becomes a problem with a host of issues that are difficult to reverse. And so Kerry here asks, can I just put this? Can I bring this up? So Kerry asks, do kids who grind teeth at night typically have airway issues? And so this is a really good question, because what we often see in the clinic is that, yes, that there are often airway issues associated with kids who grind their teeth. And so one of the biggest presentations we see is that as the so a child will either be a noticeable grinder where you can hear them down the hallway, and the parents perhaps aren't aware that this is an airway issue, and that they know this it's affecting their sleep. They're not really sure what to do about it. There's a smaller presentation of kids that have gastrointestinal worms that do present with grinding, so deworming treatment can help with that too. But the biggest presentation we see is with the airway being the problem. And so what we do is we have an assessment of the jaw, and we look at the stage of development. So kids with all of their primate teeth, or their kids' teeth, their milk teeth, this is the most common presentation with grinding, so in this period. But then as the adult teeth begin to erupt, so you get the front teeth beginning to erupt, and you start to see this mixed dentition, which happens between roughly 6 to 12, you sometimes see this wear pattern across the kids' teeth that all of a sudden is beginning to disappear off the adult dentition. So then it's a bit of a historical view that we look at the child. We can see there's not enough space for the adult teeth, which is very, very common in 7 to 12. It's really important, parents, to be looking at how your kids' adult teeth are erupting, because if they don't have enough space, if they are erupting crooked, or they are erupting behind teeth, or they are crossed over each other, that means they're not going to have enough space to erupt when their other adult teeth are coming in. So the whole jaw is going to be constricted. And so it's really important to assess your child in this period and look and be analytic as to how their teeth are erupting. And so teeth grinding is one of these signs that their airway isn't working well, that the jaw doesn't have enough space. And what we find is that if you find it in the kid's dentition, you can actually expand early and the grinding actually ceases. We've seen this in many, many patients now where the grinding ceases because the palate expands. And then what happens is that you get a decrease in pressure through the airway, and then the grinding comes down. So it shows that there is there's a connection to how the airway is functioning, you know, and why the brain is pulling the jaw forward, tensing the jaw to keep the airway open. So we should always be thinking about this when we see these sleep presentations in our children. Okay, so Alina Peter says that my 5-year-old son has hyper adenoids, grinds teeth, and wakes up at night with nightmares. His colds are difficult to end, and the solution offered has been cortisol spray, allergy medication, or surgery. So this is a really common presentation to Alina. Your child has 5-year-olds. They have swollen adenoids, grinds the teeth. So the teeth grinding and swollen adenoids is a very common presentation too. That's a very common one we see in the clinic. And if we see teeth grinding and we haven't had the diagnosis of adenoids, what we do is we take a scan to look at the size of the adenoids to see if they need to see the surgeon. And so this isn't a blanket recommendation for surgery, but in some cases where we need to get the child breathing, if we have severe snoring or we have mouth breathing, then the adenoids can be a big problem with getting the airway working. Getting a smaller child to breathe properly through the nose and training them to do so is a difficult thing. So Alina mentions that her 5-year-old child colds are difficult to end. And then she goes to the doctor and they offer a corticosteroid spray. This can help, but the issue here is that the child's respiratory system isn't working very well. So I would be recommending that they have a functional dental examination to see how the jaw is shaped, and because the jaw shape will influence the airway. And so when the airway is the airway is smaller because of a small jaw, which can be picked up in many ways. So you can see a small, high, narrow palate. You can see a bite that is sometimes like this, so that the lower jaw is sitting back. That's called a class 2 malocclusion, and that challenges the back of the throat. And so often these kids will grind their teeth. So if you see that the child has a recessive jaw or chin, that will challenge their airway. And then so what we try to do is we try to take a multidisciplinary approach to address both the adenoids, potentially with surgery if need be, but sometimes we can take other approaches to see if we can reduce them. But the waking up with nightmares is a sign of airway distress, very common in kids with restricted airways. So you want to take close note, and this is what we do: is we take close note of all these sleep symptoms to see what the airway is doing through the night, and we want to take the approach that we want to develop the jaw and develop the breathing apparatus of the child in order to make sure that their airway is functioning well. Okay, so just an added note to that question is that the MRI showed 90% obstruction when first diagnosed of the adenoids. That is where I would say that we need to think about surgery, Alina, because the child's going to be very difficult to train to breathe when they have this very big obstruction at the back of the nose. The adenoids are like tonsils. Tonsils, you can see at the back of the throat. They sit at the back of the maxilla here, and they block the airway significantly when they're this big. So part of the treatment strategy I would recommend is to consider surgery there, because without these tissues removed, it's very hard to get the child to breathe properly. Okay, so Ellie Romero says that she's getting her last 2 wisdom teeth out today. What to expect and what can I do in the healing process? Well, wisdom teeth can sometimes need to be extracted. And so what I would expect is that, look, you're going to be numbed up by your practitioner. And so you're not going to feel anything nerve-wise during the procedure. But so what you will feel is pressure and you'll hear noises and probably some pressure sensations during the surgery. Healing process, I would say you want to rest, and you want to the big strategies to keep the blood clot in place. So I find that pressure is the best way. So at least for the first 12 to 16 hours before you go to sleep that day, is to keep pressure with gauze on the socket. Remember that it's a healing bone wound, so your body needs a lot of the nutrients in order to heal this over. So the things I'm thinking is you want to have a lot of bone broth, you want to have a lot of vitamin D. So if you have organ meats, or you have you know if you're supplementing, I'd say a vitamin D and vitamin K2 supplement. Vitamin A is very important for bone healing as well. So vitamin A rich foods like I said, organ meats, eggs, dairy, if you eat that. You want to have a lot of these nutrient dense foods so that your bone socket heals efficiently, and that you get good, strong healing of the minerals into the tooth, into the tooth socket. Okay, so we have. Okay, so there's a question here on root canal or extraction. So root canal is something that is, in the biological space, sometimes looked a bit down on. I'm not completely against root canal. I'm not always completely for root canal either. What I find is really important is that you make the assessment based on how your body is. I see a lot of people that have had root canals in their mouth that are fine, and then some people have chronic infections with them. So it's really important to make the assessment of the patient first before we decide if root canal is suitable. And when I say suitability, I mean chronic inflammatory conditions. So root canals are basically where the nerve has died in the tooth, and the dentist is going to do a procedure to take the nerve out in order to stop the infection process and try to seal that off to keep the tooth there. Now, functional wise, there is an argument to keep the tooth there, because you lose a tooth, you're going to either have to replace it with a prosthetic implant, which is sometimes fine, but these things do have problems as well. And someone that is young, I would say that it's worthwhile considering the options to keep the tooth, because over your life you're going to have another treatment to replace that tooth. So it's just something to consider, that there are a few factors here that at play. So when we're thinking about assessment, you want to look at systemic risks. So things like chronic inflammatory conditions, like digestive problems, IBS, Crohn's disease, gluten intolerance. So if you have any chronic digestive issues, this can mean you have chronic inflammatory markers. You may be a person that gets a chronic infection in your tooth, in your jaw. So you may want to consider keeping, this is where it may not be suitable for you, or maybe you need to do some work before doing the root canal, because it is a mummified foreign body in your jaw once it's been finished, because the body won't recognize it because the nerve's been taken out. And so you have to have an immune system that is going to be tolerant to a foreign body. So we have to be mindful of that. So anyone with an autoimmune tendency, so thyroid issues, as I said, Crohn's or IBS, any kind of autoimmune issues like Sjogren's, or anything like skin irritation conditions, or MS, should be thinking that root canals may not be for them, because you have an immune system that is aggressive to your own body, and then what happens is that you are likely to have a negative infection reaction to a root canal treatment. So important to kind of have this whole assessment of the person before we go to a decision for a root canal or not. Okay, so someone says the wisdom teeth. Yes, so that's right. So the wisdom teeth in Eastern medicine is linked to meridian, to the heart organ. They are removing them because our jaws aren't growing enough to fit them. So yes, there's the idea that teeth are connected to meridians, and that the wisdom teeth are connected to a a meridian to the heart. But some, if you don't grow a jaw, that means that the tooth doesn't fit and you get local infection. They do unfortunately need to be removed. But the bigger thing at play here is that we need to make strategies to make sure that we grow jaws that fit our wisdom tooth. That's the really important thing. That's why nutrient dense foods early and getting our sleep and tongue posture right early, and even later in life, which is important too. It's really incredibly important to do so. Okay, so Madet has asked, recommend a functional dentist clinic or for adult and children to get deep analysis for sleep apnea. Yes, I do recommend that. So you want to find a dentist that is airway focused or myofunctional orthodontic focused, and they'll be able to do an assessment on an adult and a child for sleep apnea. And this, in my opinion, goes beyond the sleep test, because sleep tests don't give us a lot of good information for sleep apnea. So you want to get a volumetric analysis of the airway. You want to get an analysis of the jaw relationship and the functional use of the mouth as to how it affects the airway. And so all of these things will come into play when we're considering options for an airway based solution. Okay, so Holistically Happy You says that does low thyroid hormone link to periodontal disease, and what can one do to reverse this? Yes, low thyroid has a very significant impact on the mouth, and the issue with the thyroid, such as or subclinical hypothyroidism, or some people have autoimmune related hypothyroidism. This has a very significant effect on the mouth, and so both for risk of tooth decay, but development of the jaw in kids. So what I see in kids is that kids with a low thyroid, they actually don't lose their baby teeth very quickly. So a child that doesn't exfoliate teeth very well will often come back with their thyroid test being low, because the body's not turning over cells. And so if we're thinking about this to gum disease, so if you have gum disease and you also have a low thyroid, you have to remember that gum disease is an autoimmune like condition. So it behaves very much like, and in my opinion, should be considered an autoimmune condition, because the body is basically eating away the gum and the jawbone. So a low thyroid hormone, we have to think about why is it happening now. So with a low thyroid, you often have low nutrients, such as iodine for one, but then selenium. Vitamin A is very, very important for the thyroid, but also too for periodontal disease, because for strong gums and jawbone, you need vitamin A in order to create this strong barrier in the mouth. So you want to be thinking nutritionally. Okay, so there's a link here as to why we're presenting with both periodontal and low thyroid, but I would be thinking also along the lines of autoimmune issues too. So we want to be considering both as autoimmune conditions, and we want to be healing the gut lining. So this is basically trying to improve the intestinal permeability. So this is like bone broths, boosting your vitamin D levels, so both through sunlight and food, and then looking at the nutrients that we need. So vitamin A, very important for the thyroid. You may want to get tested, a full thyroid panel, in order to test if you have an autoimmune like tendency for thyroid conditions. And then, so if you do have antibodies, you have to be a little bit careful with iodine, and if you don't, then you need iodine to boost your thyroid level up again. And so with someone with an autoimmune tendency with iodine, you have to get those antibodies down before you take iodine. But you still need iodine. It's just you can't take it straight away, because you can have a negative reaction. So I would be thinking, if you have both gum disease and a thyroid issue, that we need to get to the root cause of that, which is often in intestinal permeability and nutrient deficiency, and then clear both via treatment of the gums and then nutrients to help boost the thyroid. So Does a deep gum infection in a molar always mean tooth loss if infection clears with antibiotics? So a deep gum infection in a molar means that, then this can be very variable. There are many different presentations of this. If you have a deep infection in a mole, it means you could have lost a lot of bone around that. Now, if it clears with antibiotics, it just means that it's like a band-aid, that the infection has gone, but you need a measuring assessment on the gums. Otherwise you're going to have you're going to have a chronic bone issue there, because it's very hard to clean when you have a deficit in the bone there. And then what happens is that you lose the ability to clean, then you get a chronic infection. And the problem there is that it often starts to spread. So you need to know why the gum disease was happening in the first place, but then you also do need to look at how to stop the disease from progressing. Sometimes taking the tooth out is necessary, but you really want to otherwise you'd be looking at getting periodontal treatment. You can have things like cleaning under local anesthetic, ozone and so forth. Laser can help as well. And then looking at treating the root cause through diet and supplementation. So someone's asked, how to get rid of H. pylori in the mouth if it's already removed in the gut. I question if that's been absolutely tested, that H. pylori is removed in the mouth. But this is actually a very common problem, that H. pylori in the dental plaque, does relate to kind of the presentation with stomach ulcers. So when you have a H. pylori presentation in the mouth, you need to get a periodontal cleaning. So this is where you need to get a deep cleaning of all the calculus around the gums, and that may involve treatments like ozone or laser. But then, so we need to think that the oral microbiome and the gut microbiome are two interrelated bacterial colonies, and that so when you swallow, you're swallowing into the gut. And so really important, if you're treating a gut issue, to get your mouth clean professionally. And then so you don't use broad spectrum antibacterials, but sometimes an antibacterial can help. So for instance, low dose hydrogen peroxide may help. So rinsing for say a week with that may help remove that after a periodontal cleaning. And keeping on top of that of that cleaning in order to stop that build up in the bacterial plaque. But there's a very big connection between what's happening in the mouth, and when you have a digestive problem, you should always be thinking to concurrently treat the mouth, because the mouth is the start of the digestive system, and it's really important to treat those together. And it doesn't make sense not to treat them separately. All right, so we covered a few questions today. So if you have any further questions, just let me know and I'll put them in the story. But I want to thank everyone that joined me today, and we'll come back next week. We've got a great interview set. We're going to be recording at this time interviews every Thursday evening in Thursday afternoon in the US, and Friday morning in Australia. And we'll have a new interview next week and weekly from there. Also, if you want to catch the previous interviews, if you go onto my website, drstephenlin.com, you can sign up to the mail list and you'll get an update for all of the new interviews, and we'll go from there. And then send me any questions and I'll pop them on the story. But thank you very much to everyone that joined today, and I'll see you guys soon.